Dr. Charles Moak with Allure Medical, and this is to Michigan residents who are at risk for contracting COVID-19 due to their status as essential workers and their exposure to the public, as well as those with a COVID-19 diagnosis. Intravenous vitamin C is being used in hospitals across the country to treat the most advanced disease associated with COVID-19 called severe acute respiratory syndrome, coronavirus 2, or SARS-CoV-2. Intravenous or IV vitamin C has been studied clinically for the management of the most severe disease, such as SARS, and it appears to be reducing mortality rate in hospitalized people, as well as people on breathing machines. It is also being used to reduce the duration and severity of illness in more moderate forms of COVID-19. Vitamin C is also known to shorten the duration of virus infection, such as coronavirus, by reducing inflammation, the root cause of the SARS, as well as by stimulating your immune system. Vitamin C does not make it less likely that you'll contract COVID, but it is being used to reduce the severity of symptoms, the duration of symptoms, and hence the contagiousness of the disease. It is becoming standard of care to use high-dose intravenous vitamin C for the sickest patients. Vitamin C intravenously is inherently different than oral vitamin C in that IV vitamin C can create a therapeutic or pharmacologic level in your bloodstream, whereas oral vitamin C can just keep you from becoming deficient. Additionally, vitamin C appears to have the most benefit if started at the earliest stages of the disease. Unless you are in a hospital or an intensive care unit, if you have COVID-19, it may be very hard for you currently to access IV vitamin C. If you're an essential worker who's exposed to COVID-19 on a day-to-day basis, you may also want to protect your immune system with high-dose IV vitamin C. At Allure, we have the ability to access IV vitamin C to support the immune system and to treat essential workers as well as those who have contracted COVID but are not sick enough to be in the hospital. We are also able to use the same protocols that are used in the hospital, even the same protocols that are used in the intensive care unit. Under federal guidelines, it is now easier than ever to seek treatment for COVID disease or prevention. Most insurers have waived the copays and deductibles for COVID-related diagnoses. Some people who have COVID or are essential workers may be underinsured or have no insurance coverage at all. Based on our supply, our capacities, and our ability to fund this program, Allure is treating at-risk people who are at high risk of contracting COVID due to their essential jobs, such as working in a hospital, grocery store, or interacting regularly with the public. Allure is also able to treat people who have contracted COVID. And we are offering this at Allure, regardless of your ability to pay. We will accept whatever your insurance covers, even if it is nothing, and you will have access to IV vitamin C if you qualify under our program at no cost to you. We will schedule those interested for a telehealth evaluation by an Allure medical provider and determine if you could benefit from immune support with high-dose IV vitamin C. Our operators will begin taking calls Easter Sunday at noon to 4 p.m. and resuming them on normal business hours Monday. We will assign appointment times based on some internal policies that we are setting. We will not treat sick people on the same days as well people, and we will also be scheduling people in categories of age. Call Allure Medical at 586-992-8300 to schedule. We may have to call you back as we work out the logistics of this. We do not have online scheduling yet for high-dose IV vitamin C. It is our pleasure to serve you. 586-992-8300, alluremedical.com.